today's blog for the Academy of Online Radiology Education. My name is Muhayman Sadiq. I'm one of the incoming radiology residents at UT Houston and MD Anderson in July. Today's blog is going to be on AI prognostication in triple-negative breast cancer and discussing a little about if imaging is able to predict who recurs after chemotherapy. And just a special thank you to the senior editors, Dr. Ghazi and Dr. Elsayas, for their continued support. So the article that we're going to be discussing today is on AI prognostication in triple-negative breast cancer. Can imaging predict who recurs after chemotherapy? Triple-negative breast cancer is fairly common, occurring amongst 10 to 20% of all breast cancer cases, and it's considered to be one of the most aggressive molecular subtypes. And one of the most difficult to treat because it lacks therapeutic targets, which means that chemotherapy that's typically used for breast cancer management is no longer a cornerstone of treatment. And despite advances in therapy, patients remain at risk for advancement and even distant metastases. Neoadjuvant chemotherapy is typically used to downstage tumors and assess treatment response prior to surgery, but predicting which patients recur has always been a challenge, and TNM staging, clinical exam, and pathology often only provide moderate predictive value. With that being said, imaging, including breast ultrasound and MRI, could provide a non-invasive window into tumor biology, and with the rise of radiomics and deep learning within the field of radiology, imaging data can now be mined for hidden patterns that otherwise might predict long-term outcomes that we don't typically see. A little more background on the topic. Triple-negative breast cancer is typically biologically heterogeneous. Some patients have very, very good responses to neoadjuvant chemotherapy and remain disease-free, and some develop metastases. It's very difficult to predict. The pro we've got in radiology is breast cancer is very widely available, it's inexpensive, and it's very good for characterizing lesions and treatment monitoring. And MRI is, of course, fantastic at showing soft tissue contrast and functional information through different sequences. And conventional imaging interpretation, whenever looking at these different modalities, relies on visual assessment of tumor size, morphology, enhancement, and nodal status. And this looks at these tumors on a macro level, but when we want to look at microscopic heterogeneity or biologic aggressiveness, that's where radiomics is very useful, because it can turn into hundreds or thousands of quantitative features related to different aspects of the imaging, and deep learning extends this further by learning prognostic imaging patterns, and combining ultrasound and multi-sequence MRI in theory could harness this complementary information and improve prediction beyond either modality alone. And the way that this article was structured was it was a multi-center retrospective study of just over 100 patients from 4 different institutions. They split it into a training and external validation cohort, about a 7-3 ratio. And investigators extracted radiomic features from ultrasound and MRI with the sequences listed on the slide, and combined these with deep learning features and clinical nodal staging to build a prognostic nomogram. And the results were quite impressive. So when predicting disease-free survival, the validation C-index was just over 0.85, and the overall survival prediction was just over 0.8. And the risk stratification was also clinically meaningful, with low-risk patients having 3-year recurrence metastases rates of 21 to 36%, and high-risk patients having rates of 77 to 82%, so very, very high, of course. And what this means for radiologists is this paper is highlighting the evolving role of imaging beyond diagnosis and staging, and breast imaging may soon contribute directly to this prognostic modeling and treatment planning. And there are, of course, many different applications that this could be used for in the future, including but not limited to risk-adapted surveillance, where higher risk patients could receive closer imaging follow-up, treatment intensification, based on these imaging predictions and patient risk. De-escalation strategies, the other way, so lower risk patients avoiding unnecessary overtreatment and higher hospital bills, and multidisciplinary decision making where imaging biomarkers could complement the pathology, genomics, and clinical staging. And with this being said, the results of the study were encouraging, but these tools are not yet ready to replace radiologists. Instead, they may function as decision support systems that integrate seamlessly into existing workflows. And human oversight remains essential for image quality, segmentation accuracy, and contextual clinical interpretation. And for breast radiology specifically, combining modalities is especially powerful because each modality is very good at capturing different aspects of the tumor phenotype that we had discussed earlier. And the key takeaways from the study are that triple negative breast cancer remains a high-risk breast cancer subtype with frequent early recurrence after chemotherapy, and our traditional staging systems may not completely predict long-term outcomes, and that's where radiomics and deep learning are very good at being able to extract prognostic information from routine ultrasound and MRI, and a combined multimodality model, as shown in the study, had strong external validation for disease-free survival and overall survival prediction, and future breast imaging may help to personalize surveillance and therapy intensity. And overall, in conclusion, the study demonstrates how advanced imaging analytics can help to move breast radiology from descriptive interpretation to precision prognostication, especially in triple negative breast cancer where recurrence rate is so variable, and combining imaging modalities can help to provide that individualized care in order to give more personalized care to our patients. And while prospective validation and workflow integration are still needed, the message is clear that imaging is no longer just about detecting cancer. It may soon help predict its future behavior. Thank you so much for listening to my blog.